Good morning. Today is March 17th, 2025, and it is 9:05 a.m. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Ad Hoc Appointments Committee. As a reminder, some of our committee members may also be participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. We will now receive public communications for the Appointments Committee meeting. Are there any? No, thank you, but thank you. We'll now proceed to the committee agenda. The first agenda item is to approve the minutes of the Ad Hoc Appointments Committee from February 17th, 2025 meeting. Do I have a motion? Okay, do I have a second? Second. Do I have a vote? All in favor? Aye. Nays? Abstentions? Okay, that moves. Agenda item 2, discuss and take appropriate action on the appointment of 2 members to the governing board of Sendero Health Plans. And our presenting time, we'd like to go into closed session now. Okay. I announce the committee's convening in closed session to discuss agenda item 2 under Texas Governance Code 551-074 on personal matters. It is March 17th, 2025, 9:06 a.m. Thank you.
Delicia de San Patricio.
Again. All right. Okay, thank you. We're now back in open session. It's March 17th at 10:20 a.m. As no motion was taken on item 2, we'll move to item 3, and that is to review and discuss options for training and orientation of Central Health appointees to outside boards. This has been an issue that, for example, with our CUC people that we interviewed, the issue of bringing them on complicated issues, should we sort of create or ask Direct Central Health to create some type of training session under the direction, say, of Sendero Board or the Community Care Board, that we could have the appointees been brought up quickly to speed. Who's the one we interviewed? She had been at that board training program. She's the one we put on the CUC board, whoever. No, not Zadora, the young Hispanic woman we put on. She had been to a board training thing as young leaders. I think something like that would be immensely beneficial. We could direct Central Health to do that. These are complicated issues. CUC's complicated. A lot of the things we're doing, and I think that if we could direct Central Health to do that, I think we can investigate perhaps that board program that she took to understand the dynamics. Okay. Is any questions, comments?
I have no objection. I think it's a great idea, but I think that what's good for the goose is good for the gander. And so I think that when, and I don't know how we say this, but to Commissioners Court and City Council, that before once an employee, once a member is appointed, that one goes through an extensive documented and maybe validated training course, and successfully, to the degree that we can measure that, pass it before he or she or they participate on the board.
That's a great idea.
I would agree. I mean, I feel as I came in deficient, and even as a physician, that we like going, okay. I mean, it was all novel, and I think that'd be a very, very good suggestion that we could bring someone up to speed on that. Yes,
Just
Benjamin.
expanding on that a little bit. I'm sorry, expanding on that a little bit is when I finally put my application in for the Central Health Board, I had been in attendance at Central Health Board meetings for years, and it's continues to be. I think we should that is also something that we need to take into consideration. People who have an interest in serving on Central Health or on the boards really should be actively educating themselves about what those boards do, what those entities do, we're a taxing jurisdiction, and we fund the enterprise members. We also fund those that come and apply for contracts with us. But very little appears to be done beforehand in preparation for that. And I think the best education is attending meetings. And there's, to me, very little that works in lieu of that. You can read everything, okay? But I still think that at some point in time, that people just need to be cognizant of the fact that they really should educate themselves if they're interested in being part of things. Thank you.
Yes.
And just to add a little bit, let us not forget that these meetings are online, so they can, if they're interested, they don't have to physically be here. They can watch them, via,
Yeah, I mean, when I was appointed, I came to I came to two meetings before I actually was a voting member to learn something. But, I mean, people, I was appointed, and after being asked, I knew a lot about it. But my point is, we should direct people to, I think anyone, certainly on the board of Central Health, but any board really be brought up to snuff. And I think it's one of our obligations to be brought in. Okay? Yes, Monica?
No, absolutely, and we saw that this was an agenda item, and we think it's something that's that is very needed, not just for people that are being appointed to other boards that we're affiliated with, but also for people that are being appointed to the Board of Managers. And we're working on developing a training that includes, and this is working, of course, with Perla and Brianna and Jeff, so that we can work on not just kind of general board training, like what you had described about what does it mean to be on a board, which I think is really important, but also things that are specific to Central Health and Community Care and Sendero. And I think it's important for people who would potentially be on the Sendero board to understand the MAP program and how Central Health works with community care and potential regulatory obligations and, kind of barriers. So we can't market Sendero in a community care facility because that would, you possibly have inducement issues with the Medicaid and Medicare programs. But there's a lot that we can do, and having training around Chapter 61 and 281 and what hospital districts are and what hospital districts do around strategic and financial priorities of Central Health, and how we work with our affiliated partners in collaborating and filling out those strategic and financial priorities, work on the public center model, work on what Sendero does and how community-based health plans support the work of hospital districts here in the community and across the state. And then also just information on our government affairs and external affairs and what marketing processes are in place, our eligibility and enrollment. I mean, I think that we probably could put together almost an onboarding series that we could invite current board managers and the new appointees to join and do it over, like a multi-week period.
I think if you created maybe a reading packet, a textbook, there were people who were obligated to read, and then having like mini apprenticeships where you come and spend time with Jeff or John, Pat, till we understood, and everyone coming, including the current board, are true, because we're going from being the Beverly Hillbillies to being a big thing.
That's right.
And we need to truly have all our feet planted, and I think that'd be immensely valuable to everyone here. So I would direct staff to create a, as you said, different sections: finances, relationships, lobbying, etc.
Existing contracts.
And then, just more. But hang on, more really.
That's already that's
The
my
chair
whole
has
report.
the
Excuse
floor.
me, excuse me. Is it, no, it's fine, you have to apologize. Is to an overview. I don't think we need to go on specific, it's more, how does this board run? what is our role to other boards, what's our role in the community, and just as you're describing, all these different things, taxing authority, so we have a macro view. And if we wish to delve into minutia of specific contracts, that's up to every individual president. I would direct staff to create a textbook type thing for us, that, and for certainly any new appointees, directed at each board per se, and help with, maybe work with the Sendero board, the Community Care Board, to create a textbook for their board. And then that we certainly as ourselves get a mini apprenticeship with staff for over the series of whatever weeks. Does that sound reasonable?
Yes.
Okay.
Yeah,
I'm glad.
And
Okay.
that context, I think a lot of this is complex, and so we can give people pre-reads. And I think a deep dive on some of the foundational agreements for Central Health Board members, I think or new board managers would be
And I would
helpful.
argue that also anyone applying for the board any board should be offered that textbook. Read up, so we can ask you about,
These
losses in insurance, and not, because they come in and who's gonna know that? But if they're intelligent, they're committed, they're passionate, to say, do you understand medical loss ratios now? Do you understand, what can you bring to this? Those are important, and I think to offer that to people potentially wishing to apply be very fruitful, okay? Any comments? All right, so at this time, I'd simply like to move to agenda item 4, which is confirm the next regular HUCS Appointments Committee, meeting date and time and location. Our next Central Health Ad Hoc Appointments Committee is tentatively scheduled for Wednesday, March 26th, 2025 at 3. Maybe we should make it at 2:30. 2:30 at Central Health Headquarters. At this time, I'm ready to accept a motion for adjournment.
I move.
And second from Lisa. All in favor? Aye. Okay, we are adjourned. Thank you.
Dr. Martin,
Yes?
I just want you to know